lecture, we're going to talk about some bone disorders. We've already gone over bone injuries in a different lecture, and so this is just going to be about 3 disorders that can happen with the bones. So most bone disorders are going to have to deal with some type of imbalance between bone being deposited and then bone being reabsorbed. And if they're not in kind of equal levels, you can start to have certain issues take place. So the 3 major bone diseases that we're going to talk about today are osteomalacia and rickets. Those are basically the same thing, except we call it rickets when it's in children. The second is going to be osteoporosis, which hopefully sounds very familiar to you. This is one that happens a lot in older people. And the last one is Paget's disease. And so we'll talk about what those different diseases and disorders, what they are. So the first one is this osteomalacia and rickets. So osteomalacia is a situation where the bones are poorly mineralized. So during the process of creating new bone, the osteoblasts secrete the osteoid, but the osteoid is not then kind of going to be filled with calcium salts, which is then going to allow it to harden. So when it doesn't harden the way that it should be, it starts to become weak and makes the bone soft, which makes it kind of much more susceptible for actual breaks and fractures and things like that. It's painful for individuals with this. So when they're bearing weight, so putting any weight on the bone, it can be very painful. Rickets is when this happens in children. And usually what's going to happen, because children are still growing and they're having this issue, the bones are actually going to become deformed. And often there's going to be issues with kind of bowed legs, and sometimes the knees are knocked into the middle. And in children, it's most usually going to be caused by a vitamin D deficiency. Okay, so they're not getting enough calcium. This is something that you see in children in different countries that do not get adequate kind of dietary calcium. This isn't something that you see in the United States very often, but it can happen. In this image that we have right here, this is showing is on the left, or this A, this is an individual with kind of normal bone. And what you're mainly looking at is this orangish color right here. And so in an individual that has this osteomalacia, they have kind of this widening, thicker layer of the osteoid accumulation. So you're basically having issues with kind of building bone and having the bone calcify and become hard. So this is a video that goes over kind of the disease in lots of detail. You do not need to watch this. I will not test you on this stuff, but I thought it was a really good resource that you could look at through that. Here are just a couple images of some children with rickets. You can see that their legs are bowed, and one of the individuals has kind of the knock knees. And you can see over here on this other image kind of the locations of the problems. In most bones are going to be kind of the femurs are problematic, and also the knee area is going to be problematic. And obviously, if this is not dealt with early on, this can cause permanent damage. So I was looking on the internet for kind of risk factors and causes of this disease when it's not having to do with vitamin D deficiency. And so went to Cedars-Sinai website and saw a couple different things that can kind of be the cause. So in adults, 2 major ways that this can happen is, the first is that the body is not absorbing fat the normal way. And this might sound like a good thing, so then you're not going to be able to have to put on weight, but unfortunately vitamin D is absorbed with fat very often, and because vitamin D is very important in calcium absorption, it's going to have kind of these bigger effects and can cause this osteomalacia. The second cause, it has to do with the kidneys. And so if something is going on with the kidneys, and it's usually called tubular acidosis, where the kidneys are not being able to function correctly, the fluids inside the body become more acidic, and that acidity starts to dissolve the skeleton. So those are the two main causes you would see in adults. The third, less common, at least in the United States, is going to be digestive problems that prevent absorbing of calcium properly. Okay, because in the United States, you do not see osteomalacia or rickets very often because vitamin D is something that we have a lot of. Almost all of our milk has vitamin D put into it. So next time you drink some milk, look on the label and see if it has vitamin D. And also, our skin makes vitamin D when we get a little bit of sunlight. And so this is a less common problem. All right, so the next and more common bone disorder is going to be osteoporosis. And osteoporosis is when bone reabsorption exceeds bone deposition. So instead of having kind of a normal equal amount of reabsorption and deposition, you're having more reabsorption, which means that you're having less bone material, and that is going to make your bones weaker. So the matrix itself is going to remain normal, but the bone mass will decline. And you can see in these two images, we have a normal bone and we have an osteoporotic bone, and you can see how they're it's not as thick and has kind of these holes in it, which is going to make this weaker. Okay, spongy bone of the spine and neck of the femur are the most susceptible areas. And so people often with osteoporosis are going to have back pain and kind of hip area pain because these areas are going to be one of the areas impacted the most. Individuals that have osteoporosis will often have fractures of both the vertebra and the hip. And again, these ones are very problematic. Older people can get hip fractures a lot easier, and so it usually has to do with this osteoporosis. So here's some risk factors for osteoporosis. Most of the time, osteoporosis is going to affect women who are postmenopausal, so they've gone through menopause and are no longer ovulating. This is going to affect 30% of women aged 60 to 70 years old, and by the time you're 70 or 80 years old, about 70% of women will have this. So this is just kind of a natural process that happens when women age. The reason why it's more problematic in women is because estrogen is going to play a really important role in bone density, and as after you go through menopause, your levels of estrogen are going to change dramatically, which then is going to cause osteoporosis to be a bigger issue. So men are less prone to osteoporosis, but they definitely can have osteoporosis. And they mainly are going to be protected by testosterone, because testosterone is not going to have the same kind of role as estrogen does in women. Other ways that you can have risk factors are not exercising enough and not putting stress on your bones. So your bones need to have stress put onto them so that they can kind of build and build strength within them, kind of that has to do with how the weight is being bared on the bones. If you do not eat enough calcium or protein, and smoking basically is bad in every way, seems to affect almost everything. So smoking is also going to be an issue. Some people are going to be genetically predisposed to osteoporosis. So if this is something that runs in the family, it's probably something that you would need to pay attention to and try to lessen your risk factors. And then a couple different hormone related conditions. So hyperthyroidism, so having too high levels of thyroid hormone can be problematic, and also having diabetes could kind of increase your risk of osteoporosis. And finally, the consumption of alcohol probably, it's going to have to probably be at a certain level of alcohol, and certain medications can increase your risk for osteoporosis. So how do we treat osteoporosis? Well, the first thing is that you can do traditional treatments that include giving calcium supplements, vitamin D supplements. Again, you're going to see this kind of connection between vitamin D and calcium because they are very tightly connected. Making sure that individuals are having weight-bearing exercises because your bones can then remodel and become stronger. Hormone replacement therapy, so giving women estrogen is one of the treatments that can go along with this. However, there are side effects. So it does slow bone loss, but it won't reverse it. So once it's lost, taking hormone replacement isn't going to replace the bone that has been lost. So you'd have to have other treatments like calcium and vitamin D. But unfortunately, hormone replacement therapy increases your risk for a couple different diseases. So heart attacks increase, stroke, and breast cancer also can increase. These are you kind of have to talk to your doctor and weigh the costs and benefits, look at the family history, and see if this is something worth going for. Some drugs that are used for osteoporosis, one of this is bisphosphonates. And this is going to decrease the number of osteoclasts and kind of their activity. So remember, osteoclasts are going to be the bone cells that are going to be in charge of reabsorbing the bone and breaking it down. And so if you can make sure that those are at a smaller number and not as active, that will help increase kind of bone density. It can partially reverse osteoporosis in the spine. The second one is DenoSwab, and this is another one. It's going to work in a similar way where it's going to kind of impair the osteoclast function. This is specifically a monoclonal antibody that is shown to reduce fractures in men with prostate cancer. Okay, and it improves bone density in the elderly. You do not need to know kind of the details of how osteoclasts are going to be kind of regulated, but just understand that the osteoclast is the kind of target for both of these drugs. So preventing osteoporosis, so most of us are kind of, younger and need to start thinking about making sure that our bones are going to be strong for, the rest of our lives. And so I found this infographic that kind of shows different things about osteoporosis. Some of them are kind of confusing because it doesn't really tell you, well, is caffeine good or bad, or, things like that. But some things are, you want to make sure that you have plenty of calcium in your diet in early adulthood and throughout your life. You want to make sure that you reduce the consumption of carbonated beverages and alcohol. This is a problematic one. I know a lot of people like to drink carbonated drinks all the time. I know I do. Unfortunately, they can leach minerals out of your bone and decrease your bone density, so it is something to pay attention to. You also should avoid, smoking, and make sure that you exercise. The caffeine on here, so I looked this up. Caffeine doesn't seem to be a problem in most individuals, but if you are elderly and already are prone to osteoporosis, it does appear that caffeine can be problematic, and you'd want to watch your caffeine consumption. You want to make sure that you do a lot of exercises, specifically weight-bearing exercises, so that your bones are strong and can withstand that weight. And this will just increase your bone mass above normal, and then that kind of buffers in case you have potential, other things that may cause osteoporosis. Again, here's a video about osteoporosis. It's going to go into a lot more detail than we will, but I just thought it was a good video. So if you want to watch it, the only things you'll need to know are the things that are on the previous slides. The last disease we're going to talk about are Paget's disease, and this is when there's kind of this haphazard, they call it, bone deposition and reabsorption. And so the bones are remodeling, but they're doing it haphazardly and things go awry. As you can see in this image over here, this individual's bones, you know, the tibia is completely are deformed and is making the leg bow completely. And so this is kind of can be deforming if it gets bad enough. So it's called Paget bone. And so what happens in this situation is that you have a very high ratio of spongy bone to compact bone. And when you look at the Paget's disease, the bone looks kind of, they sometimes call it moth-eaten, where you can kind of see inside the bone and you can tell that it's not quite as kind of thick and compact as it usually is going to be. So there's this reduced mineralization. Now there's certain areas of the skeleton that are at higher risk. The spine, the pelvis, and the femur and skull are going to be some of those areas. And if you see this image with kind of the full skeleton, what this is a full body scan, and they give the individual a radioactive tracer, and the tracer is kind of taken into the bone in areas that are involved in Paget's disease. And so those areas that you're seeing with a dark kind of stain are areas that are affected by the Paget's disease. Other areas that are lighter are not as affected. And so in this one, you can see the, it doesn't appear that this individual's femurs has too much damage, but the pelvis for sure, the spine and the skull have a very dark black color, meaning that they are being affected. This is something that occurs mostly in people over the age of 40, and we don't actually know why it starts to happen. They think that it's possibly from a virus, but at this time, they do not know exactly what's causing Paget's disease. Okay, and the way to treat this is that they'll give some drugs, some calcitonin and bisphosphonates, again trying to kind of slow down and help regulate bone reabsorption and deposition so that they're kind of more regular. Okay, and here is a good picture of kind of the pelvis. You can see on the top normal bone, kind of this is what bone should look like in an x-ray, and then this moth-eaten appearance of the bone with the individual that has Paget's disease. And this little infographic right here is just kind of showing you what's happening during Paget's disease. So lots of kind of problems with the misshapen bones, and the bones are also going to be at a higher risk of fracture. And again, another video that goes through kind of the details of this disease in much more detail. You do not need to know all the detail that's in the video, just the things that I've said on the previous slides. All right, thank you.